sir. Over to you, doctor.
Good evening, friends. This is Dr. I.R. Rajkumar, welcoming you on behalf of IPS Vadodara and Bombay Psychiatric Society for yet another session of Brain on Wednesdays. The topic of the day is early life stress and brain development. To talk about it is Dr. Susmita Sarkar, and to chair the session is our very close, near and dear, Dr. Rikshada. Dr. Rikshada, can you take over?
Thank you so much, Dr. Rajkumar. Welcome, everyone. At the outset, I apologize for my voice. I'm recovering from a viral flu. And it's a privilege to be chairing the session today. As some of you all may know, I'm the president of Bombay Psychiatric Society, and it was an amazing tenure that's about to end. And the Brain on Wednesday series has been a particular favorite academic activity of BPS, but especially me. So in the last month that of my tenure, I'm chairing yet another session is doubly is very heartwarming for me, but it's doubly enjoyable just because I'm again chairing a session with Susmita, and she knows that I love her work and I love the way her brain works, and she's going to tell us how the brain develops in early life stress. So looking forward to the session with everyone, with lots of learning and a lot of interaction after the presentation is over. And with this, I'm going to once again thank Dr. Rajkumar and IPS Vadodara. I'm going to thank Malay and Bhaskar and Alchem for their support. And I'm going to hand the session over to Dr. Sarkar.
Yes, Susmita.
You want to start?
Yeah.
I have joined.
That's good, Dada.
Great.
My screen is showing.
Yes.
Yes, we can see your screen. We can hear
We
you.
are able to see you. Your slides also.
Go ahead.
Wow.
What happened, Susmita? Any problem?
Network is freezing.
Yes, sir. Like, I'm not seeing my presentation here.
Okay. Actually, turn off your video.
Okay.
Or you can share your screen again. Come to the Zoom.
Yes. That also is a good idea.
Yes, it's visible.
You're on.
Unmute yourself.
Are you seeing your video?
Yes.
Yes.
Okay.
Okay. Sorry for the glitch.
No issue.
Not a
Good
problem.
evening. Okay. Good evening, everyone. First, I want to thank Brain on Wednesday and the BPS and the Alchem CNS, all whoever trying hard to put this seminar bi-weekly. And it's my privilege to talk on the topic early life stress and brain development. So, what is stress? We use the word stress very commonly, like I'm stressed out, this thing stressing me out. So, what do you mean? Do you in common language term? So, stress is some emotional upset. It's emotional upset, and how in psychiatry, in psychological term, we are seeing stress. In psychology and psychiatry literature, stress is a term to describe a diverse range of experience from severe trauma to day-to-day hassle. And it's one thing is that very subjective in nature. Some event may be very stressful for me, and some event may be not stressful at all for someone else. So how can we define stress biologically if it is different according to the individual, according to the context and the perception of that event? So the how come we overcome it? So one of the most logical definition of biological definition of stress is any external or internal stimulus that can disrupt the homeostasis and causes permanent adjustment to organisms physiological and psychological set point. Just the last terminology is important. Like it can be like anything externally happening into any change of environment, even internal environment, fever or something else, something whatever possible, and that is disrupting the homeostasis, and it's leading to the some permanent changes are happening, and there is changes in the physiological or psychological set point. Like this is a new program that has been set. So my topic is early life stress and brain development. So early life means any significant event that happens before 18 year of age, and it can be very diverse in nature, from adverse childhood experiences to abuse and neglect. It can be physical, emotional, sexual abuse, environmental factor like toxin, nutritional deficiency, inadequate stimulation, and in case of like family environment, parental substance use, parental mental and physical health. So all this thing can affect the development of brain, human brain. So it has been how this concept came, like for some stress in early life, and there is a long term impact in the later life. So it has been observed that people who are presenting with psychiatric history, when we take history, like previously when psychiatry started as a branch, so in history, one thing they were getting association with stressful event like abuse or attachment style parenting habit is not good, and there is some form of abuse. So they're trying to understand how this is causing. So there is a shift of from like behavioral. Initially psychiatry is more of behavioral observation or observational basis, some from observational basis, and we are running to the biological basis. So one of the most popular theories, attachment theory. We know the experiment was done in strange situation. It has been found that there is established fact that early caregiver bond create a, like it's very important according to the attachment style, like secure, anxious, avoidant or disorganized style that can develop child perception toward others and self perception and how they're perceiving other human being or his or her environment. Then life course theory, it's more of like we are moving towards biological explanation. There's this theory explains that there is in throughout the life course there are adverse effect, adversity. So there is a cumulative impact of this adversity, and they try to quantify it like dose response relationship, then stress sensitization, how this individual is sensing it, and how much is the sensitivity, how much they're reacting to it. So they're explaining risks across the developmental age. Then toxic stress model, this idea came with like not every stress they divided into three, like one is good stress or use stress, then one is manageable which can be buffered, and one is toxic stress. And it has been found that prolonged exposure to stress causing alteration in the brain structure, architecture, and functional changes. Another model is an allostatic load model, which we know what allostasis is. in homeostatic condition, to brain always try to adjust to any new demand or or any stressor. So it's the new new state of the brain that is trying to cope up with this difficulty. So these are adaptive processing, that is allostasis. And during the process of allostasis, there is lot of oxidative stress and there are continuous wear and tear going on, high HP axis dysfunction. So they try to find out this effects, how they're protective, how they're damaging. So um, they actually measured biomarkers like chronic stress, alteration of cortisol pattern, then inflammatory markers like interleukin 6, TNF alpha, then telomere length, metabolic indicators. So they try to understand stress response system, whether it is hypo or hyper responsiveness. So before going to the ELS impact on brain development, let's recapitulate brain development in very short. So there are different stages of brain development. It in early stages, that is first week to 8th week, important event is neural tube formation and basic structure development. Then in mid pregnancy, there is neural tube closure and other structure development. And in late pregnancy, migration occurs and different connections are established. And from birth to 2 years, in this year there is explosive synaptogenesis, and brain synaptic density is 150% of adult level, and this time myelination also begin, and brain reaches is 80% of adult weight by 2 year of age. From 2 year to 12 year, as the brain is expanding like this, so some brain, according to multiple factors, decide which synapses are gonna stay and which synapses gonna be pruned. So that is also mainly mediated by the connection which the environmental demand, so which connection to be eliminated and which connection to be strengthened. Then 12 to 25 years, here the prefrontal cortex remodeling and white matter volume start growing, and there is neural efficiency, cognitive function, all this thing. And then neural limbic system maturation occurs. And from 25 to adult life, there is continuous like neuroplasticity is there, but neurogenesis occurs in few region like hippocampus and some other area. And after the age of 40, there is 5% decade, 5% decrease per decade. And as these are decaded, so there is compensatory recruitment of additional neural networks. And what are the important process related to this brain development? First is neurogenesis, the name itself implying that creation of new neurons. Cell migration, uh, actually the cell migration is very important step in brain development. Neurons need to be traveled to their destined site. And various psychiatric disorder, neurodevelopmental disorder, it has been found that cell migration is affected. Abnormal cell in abnormal, normal cell in abnormal position, and so on. And then self differentiation to transform into specialized type of cell, microglia. And then synaptogenesis, the connection between the neurons. And then later to strengthen in it, myelination to speed up the impulses, and the pruning, like unnecessary connections are eliminated. So these are very important processes, and there are n number multiple factors which regulate all these processes. So I'm not going details into that. So what we can see, one thing we can see that in brain development, as we see, like in early stages, first week to 8th week, mid pregnancy and late pregnancy, very important processes are happening in terms of brain development. But in definition of early life stress mostly focuses from birth to 18 year of age. So there is uh, this thing I want to emphasize, because this critical intrauterine period and feto-maternal interaction, that is also very important in the context of brain development, which I'll be discussing later on. So that is what I was trying to say, that there is early life stress. Uh, Prenatal period is also important. So this is like approximate time frame when there are different process of brain development happening. So I'll come to this question later on. Is CSA overhyped? As of now, whatever I have discussed, it is clear that it starts from the prenatal period, and multiple event can uh, some individual brain can identify as stress or not stress. And while taking psychiatric history, we tend towards find out, we spend a lot of our energy in finding CSA only, but other things are also important. There are multiple factors uh, that determine the brain development and relation between ELS and brain development. There's the timing, the duration, is it chronic or acute exposure, and then how sensitive period, in which period that is occurring. The brain develop period, which are very sensitive to minute changes. So if that window period some stress is happening, so it gonna impact the brain development differently. So what is the ELS impact on brain development? When we describe stress, the first the thing in response to any stress, maybe it external or internal, the first stress response system that comes into play is the HP axis, hypothalamic pituitary axis. So when there is any stress, that activates the hypothalamus, which in turn releases cortisol releasing hormone, and that is on adrenal gland. They're producing cortisol, and cortisol in turn mediating, regulating autonomic system and other system, and it's it's trying to cope up with the situation. And what this ELS does, different kind of early life stress cause this HP axis dysregulation. Like there can be hypo or hyper responsibility. There can be increased cortisol level, and one in any system, in any biological system, feedback mechanism is always important to keep the balance, like to keep all the things in optimum level. And ELS impact the feedback mechanism also. This is the diagram explaining different stress, how they're impacting, and how chronic stress is affecting, including the also they're also affecting our immune system. And due to the long term, there is a cortisol resistance, and there in turn the negative feedback mechanism is lost. Cortisol is increasing, but there is no inhibition or downward regulation from the hypothalamus. So how can another mechanism is programming during critical window, that is critical time period, and how this there is altered stress response pattern, that is through the HP axis I have discussed. And the one thing we have to understand, this whatever neuroendocrine modification happened, that is HP axis hypo or hyper reactivity, dysregulation, lack of negative feedback. So all this thing may initially serve as adaptive mechanism, but it often fail to meet the later life demand, and usually in the changing context. So this mismatch uh, increases the sensitivity and increases the vulnerability towards mood disorder, anxiety condition, and stress-related other disorder. And now coming to the role of gene and environment, we use genetic and epigenetic uh, very often in psychiatry. Whatever is not explainable by genetics or the other thing, we say there is some interaction with the environment and epigenetic changes happen. But this is not that simple and easy. It's very complicated. But there are few established genes, few established genetic changes like polymorphism, few established epigenetic changes, and they have been found with the ELS. So that I'm going to discuss. Like individual stress response variability. Individuality, even it has been found that same, like identical twin, identical stress or exposure to identical stress, but their responses are different. So there is a factor of individuality and the stress sensitivity. It depend on again on the brain development, how like prefrontal cortex is developed, how this cognitive appraisal mechanism is there, threat versus challenge assessment, and then environmental, genetic and environmental interaction that may cause some changes. And there are even also sex based differentiation is there. Like it has been found that female are more responsive towards stress due to the estrogen modulation pathway, but they're greater, they have greater stress resilience metabolism mechanism than that of male counterpart. So these are few established genetic variants that that has been changed by the ELS or early life stress. So it has been found that polymorphism of serotonin receptor transporter, there is polymorphism, and that is associated with adverse early life events. And it has been found that in patient with depression, anxiety. Another one very oftenly discussed is FKB5. So this FKB5 is related to the stress response system or HP axis. Actually, what happened if there is abnormal FKBP5, there is a difference, there is change in the transporter. So increase glucocorticoid entry into the cell, and that is and also there is impaired negative feedback mechanism. So there is increased cortisol level from day one. So that is causing, that is a different set point. HPA axis, different program happening due to this. Then other important is cortisol releasing hormone CRH1 polymorphism, and it has been found again with ELS and uh, associated with the depressive disorder. So coming to the epigenetic, if we want to discuss epigenetic mechanism and ELS, then it's not possible in this time period, because how there can be epigenetic changes and what are the different checkpoint level, multiple level, like from DNA to transcription into RNA, RNA from RNA to translation into multiple proteins, then in translation, post-translation mechanism, like folding, chaperones, all these things. So any of the stages, and all the stages are controlled by very intricate mechanism, different proteins, different cellular structure. So anything at this time point, it's very difficult to say that this is causing this epigenetic change. So I'm keeping this disclaimer, but what are the most established or common finding? There's DNA. One is DNA methylation in DNA level. I'm now discussing in the DNA level. So one is DNA methylation. Methylation usually silence gene expression. In gene expression, there is two things: either silencing or the gene expressing. Nothing like hypo or hyper. So it has been found that ELS is associated with uh, glucocorticoid receptor, there is methylation of this receptor protein, and that is causing decreasing stress resilience. And histone modification, it has been found with like with the BDNF, and the BDNF, we know it's very important neurotrophic factor in brain development, and it affects neuroplasticity in hippocampus and prefrontal region. Histone acetylation and deacetylation, these are also important phenomena that they also regulate the HP axis regulation genes and neuroinflammatory pathway. And there is this effect, exactly what is happening, what is causing what is till now is difficult to discuss, but it is found that methylation is more of uh, permanent, rather than histone modification are very sometimes found reversible, like environmental enrichment, social support, and other like mainly pharmacological intervention targeting the epigenetic enzyme, and this DNA-based epigenetic mechanism can be reversible also. Now coming to the RNA-based epigenetic mechanism, there are lots of discussion, but two important established thing is microRNA and long non-coding RNA. They they even INC RNAs, long coding RNA, they can act as scaffold for protein complexes, and they regulate chromatin structure. So chromatin structure, if it is condensed or not, according to that, the sites are exposed or not, that will depend on, it will go for transcription or go for replication or not. And microRNA, that they are non-coding RNA molecule that typically they suppress the gene expression. Now coming to more complex mechanism like intergenerational epigenetics. So there is a germline transmission. We know that there is studies show that there is this methylation in DNA at NR3C1 and AKB5 promoter regime in sperm of men. These are correlated with altered stress responses in the offspring. Then in utero environment, if maternal cortisol level is elevated, previously we had that thing like placenta is like very strict barrier, it doesn't pass anything, so baby is protected from all this thing. This is not true. There are so many things that can go through placenta, like higher cortisol level also affect the HP axis of the uh, newborn. So that can also happen. There are specific RNA mutation that has been found with um like the father having prenatal exposure to childhood. So they're having differential development in prefrontal cortex and amygdala, that is the emotional center. So like effect of there can be transgeneration, like grandfather, maternal grandfather, paternal grandfather, maternal, like third generation, up to third generation, and more also, maybe more also. We have to stress that to find out like what exactly happening here. And there are different study, like they have find out specific, there are specific observation that different kind of stress, different kind of early life stress, having different genetic, causing different genetic or epigenetic changes, like neglect, that can be physical, that can be emotional neglect, so that causing DNA methylation, and that is causing altered responses. And then trauma can cause DNA methylation in NRC31 and BDNF. And dependent on the type of abuse, also physical abuse, sexual abuse, childhood abuse, emotional abuse. So there are different gene or genome region affected, and that in terms affecting the gene brain development. One of the upcoming concept in case of ELS is the tripartite axis, that is neuroimmunoendocrine axis. And name itself indicated is like very complex system, and there is interconnection between them, and there is bidirectional communication network among them, and these things are vulnerable to early life stress exposure. We know nervous system, CNS, then PNS, in PNS, mm, then autonomic nervous system. All this thing determine how, like we are receiving the stress, and then how we are responding through catecholamine release or other energy metabolism. Immune system, that there is a communication, immune system is there is communication with neural and endocrine pathway. How? Through cytokines and immune cell. So there it has been found that ELS exposure increases the pro-inflammatory cytokines. Then endocrine system, how these are related to obesity, metabolic syndrome. So this is in nutshell that early life stress, depending on the number, how many stressor, the intensity, duration, acute or chronic, how, what is the type of this, and yes, then how it's and like along with genetic and epigenetic parts taking into place, how they're affecting neurodevelopment, that in terms changing the neuroendocrine stress responsiveness. There can be hyper responsiveness or hyper responsiveness, and then the allostatic process is happening, like everyone, the normal physiological things are changing into different set point in autonomic nervous system and immune system, endocrine system. So there is one thing can happen, that there is adaptation resilience according to the genetic epigenetic changes, and there can be maladaptation, increased vulnerability to stress. So this ELS only doesn't limited to the brain only. It has impact on systemic. There is systemic impact. Specifically, three system. It can affect all, because we know brain is the master organ, and it controls other system, all other body system. But three most important systemic manifestation or systemic impact of ELS is in metabolic system, cardiovascular system, and GI system. In metabolic system, it has been found that DNA methylation to pre-opio melanocortical and neuropeptide Y genes altered, they are leading to altered appetite regulation and energy homeostasis. And there is increased risk of more than 40% risk of obesity by the age of 18, individual who are exposed to ELS. And there is in decreased insulin sensitivity, increased insulin resistance, and that in turn giving the metabolic syndrome. Cardiovascular system impact through this HP axis regulation and cortisol production, and also through the new immune pathway, that inflammatory markers, they risk the chance of atherosclerosis. And through this histone modification affecting the catecholamine genes. So these are affecting, and it has been found that there is increased risk of cardiovascular event like hypertension, stroke, coronary heart disease. GI system, there is like gut-brain axis, that is also hampered by the microRNA related mediated changes, and there is decreased number of good bacteria and increase of bad bacteria in small is simple time movie use, and they're causing development of different functional GI disorder like IBS and IBD. We found very often with our patient. So what we can do with all this knowledge, like how, what are the ELS, how they're affecting. So one thing we have to, through the discussion, we are finding some of the lacking. We have to try to fill up the lacking. Like we don't have any quantitative, we don't have much of quantitative measure for the stressor. like it's in qualitative level. So we can find out most biomarker and their levels, how they're related to it, and including prenatal period is very important, while history taking also, like how they're impacting. And we need like whatever changes we are seeing, another thing in epigenetic and other whatever I have discussed, like neglect causing this changes, who knows, this factor is responsible for DNA methylation. At the same time, a child is been bitten continuously by the father or mother, and the child is also having nutritional deficiency, some factor, some fever occurred during that time period. So n number of factors are happening. So how we are particularly pointing towards this, like this is the stressor and this is causing this histone methylation, DNA methylation, or like acetylation, and they are causing the changes. So we need to have mm, like uh, better system to find out this. And three generation like at least three generation multi-generational perspective we know, and that is what going on. So what is the application, what we do with this knowledge? So first of all, identifying this tracer, what can and identifying the factors, we can focus on the preventive measures. Like there are multiple points, multiple areas where we can modify changes. Like as I discussed, this early neonatal period is very important, maternal nutrition is important. So like addressing the psychological issue, psychiatric illness of the mother, because that will have impact on the pregnancy and pregnancy outcome. So treating antenatal mother, and then there are infection, malnutrition, and other systemic disorder that they are having during pregnancy, that has impact on the child. So there are some area of prevention and some primitive measure we can take. And then by identifying the sensible biomarker, so we can at least like we can't quantify at that moment, but at least we can say that this person has more of this load, more of genetic risk to develop this. So whom to give drugs, or like how to explain patient like why you need to take drugs. So in that case it may be helpful. So that is what, like last I want to say that presently what I'm saying, Yale is doing this and that. There is no complete like it's not like absolute. And even the ELS, is it a causal factor or associated with this? It's not clear, but yeah, these are the findings that has been commonly seen, and studies revealing all this till now, till date. So these are my references. Thank you.
Thank you, Sushmita. That was excellent. Taking us back to basics, but adding to our knowledge by new information. Thank you so much for a lucid presentation. And I'm going to invite Dr. Bhaskar Mukherjee now for moderating the session.
Yes, I am already there. Actually, it's a good presentation because she tried to first define stress, then she tried to add about early life stress, and then she tried to go into deep molecular mechanism. But we have to remember a few things. Number one, all the findings that we still know are from mostly animal studies with few human studies. That is number one. Number two is there is a problem of translating animal studies to human studies in early life case. Because in animal model, early life case is mostly taking away the mother. Now, maternal deprivation for animal and our understanding of early life stress in human, whether that is same or different, we don't. Lastly, Susmita has touched a very important point that perinatal and prenatal history and prenatal events should be included in the early life stress because maternal fetal interaction is happening when majority of the brain is developing. Brain develops majorly inside the womb. So we should take care about the what is happening inside the womb, the maternal fetal reaction, the effect of maternal body system, and various other things on fetus. So overall, this would be my overview from this presentation. So, any more question? Any question?
There's nothing in the chat box yet, but I'm hoping that people will pipe in with some questions.
Otherwise, I would start questioning, but let's hope there is some question.
Um,
Anyone from audience? Please. Today, audience is not interested in asking the questions. So,
see, Sushmita did such a great job that we have nothing remaining to ask.
yes.
Right, we do have one question that Nachiketa is asking. Any ways to measure the allostatic load?
Like there is no quantitative measure till date, but things that we are trying from like history taking that what from what I said from perinatal to prenatal to antenatal postnatal like important development period which are sensitive to brain critical period during that period and nowadays it has like it's for the last 10 years I guess like they're trying to find out a biomarker for this like interleukin 6 TNF alpha then measuring the cortisol level so these things are there but in my like knowledge there is no definite thing to measure or definite scale or anything abstract to anything definite to measure the allostatic load that we can just predict or we can predict the risk like these factors the number of risk factors is more so like in simple term allostatic load is more so that is
That is a good way of explaining because allostatic load is something that is again not a scientific term. That is a term of psychology that we adopt. So it is never a quantitative measure. It is just a descriptive. So standing there, we have to find out our own way of defining it by pure scientific. As we have not done that yet, there is no possibility of measuring allostatic load at this. Then there is another question. Yes, actually, three questions. Dr. Karisma Rupani has asked, is any part of this reversible? And she has actually extended the question, or do we have drugs that can halt the neuronal damage?
okay. I'm taking the question. So, is that reversible? That is also like I discussed some changes, especially the epigenetic changes that we talked a lot, especially the histone acetylation, they can be reversible, they can be changed. And asking about drugs, our drugs are already doing that, like changing the trajectory of brain. We are trying to change that, right, with our drugs. So at long term, initial neurotransmitter, what we know, but long term, we know what our drugs are doing. They are actually changing the molecular pathway, involving the molecular pathway, and like decreasing or halting, or what we can say, that the process of neurodegeneration. There is like in psychiatry, there one thing neurodevelopmental, and then in terms is neurodegeneration, and in between this multiple combinations are happening. So our drug, yes, our drug can modify this thing. uh, Halt, I don't know, but yes, it helps.
Karishma has asked another question. Is there any specific class of drug that can do it?
This is also a question, like in case of if I want to discuss with the antidepressant drugs, there will be like there is no antidepressant antipsychotic, but in usual time, what we mean by that, in the long term, there are a few mechanisms already established that apart from this neurotransmitter thing, in the long term, what they are doing, the affecting on different neurotropic factor, BDNF, and all this. There are multiple neurotropic factors and other uh, gene regulating protein or extracellular matrix. So there is change in that. And with SSRI, it had been found that the BDNF level and the like increased gene expression of the resilience factor, and that's how it's one thing. And now if we want to discuss a brain that is hyper excited, for that brain, low dose antipsychotic, even low dose antipsychotic can cause this thing, like decreasing the neuroinflammation, decreasing the hyperactivity and of the brain, and the energy expenditure of the cell, and in terms that can also be possible. And in drugs like anti-epileptic drugs, they're also working in this kind. Then our favorite lithium valproate, they have also neuroprotective role. It has been found that like in case of like in terms of uh, anatomical and functional level, it has been found that increasing gray matter volume, increasing hippocampal, mostly regarding depression and other thing, hippocampal volume, like with volumetric uh, MRI and all this thing, they're trying to measure the how it's affecting with how our drugs are affecting, and it has been seen that there is change. There is fMRI changes, how brain is responding to emotional stimuli, and in term of anatomical, physiological, both level, it's working, our drugs. So these are the few. I'm just telling. Sarah will tell more.
Okay, the thing is, good answer, Susmita. I would just say that all the precise epigenetic mechanism that can be caused by early life are also targeted by all our drugs. There is no specific drug class. For example, let's say imipramine. Imipramine causes demethylation. How? It actually blocks methylase enzymes, so methylation cannot happen, and ultimately by other process, because methylation is a constant loop. So if methylation is not happening, then happening of demethylation occurs first. Then comes our fluoxetine and our fluvoxamine. These two drugs directly cause demethylation. Then come clozapine. Clozapine not only removes methylation, clozapine is one of the drugs that removes hypermethylation. Now, what is hypermethylation? Methylation, the one layer of methylation has already been occurred. Then on that methylation layer, another methylation is added. This is called hypermethylation. Clozapine is known to remove hypermethylation. In fact, various CPG islands, which are very regulated in part in the DNA, they are hypermethylated in various psychiatric disorders and various non-communicable disorders. Clozapine has been found to remove this hypermethylation. Then comes even haloperidol. Haloperidol causes change in histone methylation and histone acetylation balance. Then valproate is a histone deacetylation inhibitor. Then comes various other group of drugs. I would say that don't go by our traditional drug class. All drugs that actually work in brain, they work via these pathways. Now, there is Bharati Jana. She has asked ELS and traits with excessive impulsivity. So, she is talking about externalizing trait and ELS, that interrelationship.
There is definite relationship with like ELSs are the ELS with like early life stress and excessive impulsivity. It has been found that maternal exposure to alcohol or other toxin or substances that are causing more of ADHD. There is increased chance of ADHD, and then uh, other like alcoholic father. There are like few famous like previous experiments or and like hypothesis has been there, like fathers or paternal or parental alcoholism, how it's affecting, and then the other environmental factor that is also like anything. It's actually changing the brain trajectory and like temperament. All these things are this is part of the temperament. Externalizing trait we can consider as difficult temperament child. So anything that is affecting brain development can affect the will affect the temperament of the child. So it's like I don't know like what specific thing causing it, but definitely logically it will ELS are responsible, like ELS have impact on that.
Bhaskar, I would like to point out impulsivity in internalizing disorders is also commonly seen. So impulsivity is a trait that is common to both externalizing and internalizing. And also gender will also play a role in terms of ELS impacting impulsivity. Same way, gender will also play a role in externalizing and internalizing disorders.
Nachiketa too. Yes. Nachiketa has asked, will the changes be limited to psychiatric and behavioral symptom, or ELS affects other systems too?
I think I have already answered, like as brain is the master organ and controlling all body systems, so it will affect almost like every body system, but more established fact that I have discussed that that is the endocrine system, increasing like metabolic syndrome, and cardiovascular system, increase risk of cardiovascular incident, and then in GI system, IBS, IBD, these things are there.
Yes. Do early life stressor has positive effect on brain development? Dr. Imran Ali Sivaji has asked this question.
Yeah, it can have like uh, it 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 also depends on multiple factor, like genes that are all this. I think I have put a slide regarding that.
Yes, the schematic slide.
Yeah.
Yes, this one.
This one. Like there is allostasis in the system, and that can, according to the organism equilibrium, in case of organism we are like considering human brain, so it can go into the adaptation or resilience, and then successful stress inoculation, and sometimes if the same things happening also, we develop better strategy, our brain develops better strategy to deal with that thing. So it can be adaptation, resilience through the genes, or the what, through the protein who are regulating this, who are responsible for the resilience, and it can also lead to vulnerability, maladaptation, and like more vulnerability to stress and other things. So both way can happen. In psychological term, there is two thing, like eustress, distress. Like some level of stress, like the kind of stress that are helping to develop a new skill set or increase like adaptability, that we can say as resilience. They're increasing the resilience of the brain system.
The entire concept of positive effect on brain development is also something, when we are translating into functionality, or let's say everyday clinical implications, is vastly different. So just that positive effect on brain development is also something that can be a little misleading to us in terms of early life stressors, would be my kind of take to it.
So, any more questions?
Sir, one more question I left for the audience. Is CSA overhyped?
Yes, it is overall.
Sir,
It is
that is for
overall.
audience.
Okay, now that you say it is overhyped, explain it. Why do you have that viewpoint?
I think I already explained it, but in nutshell, if we were
Let's hear from Bhaskar, just because he opened his mouth.
No, that is let her explain. Then I would go on point by point. First, let her explain.
So, in a nutshell, in my slides, I have discussed about multiple life events, multiple which are considered as stressor. So, one of them is child sexual abuse. Abuse, in that abuse, it can be physical abuse, emotional abuse, sexual abuse. So, in all this umbrella term of stress, or in different kind of uh, early life stress, child sexual abuse is one of them. So first, this thing dilute the importance of it, because we have other things also going on, and as like the developmental period, if we want to consider as a which period is more sensitive to developmental changes, or so-called critical brain developmental period, it's the prenatal and early stages, like I described. Yes, like adolescent period, pruning and other things are important. And on mechanism, how uh, like I have discussed that even in twin also, identical twin, response is different. So individuality matters. Like one thing, like CSA can happen. Like if we consider both two subject, CSA has happened for someone brain. It's nothing. It's not insignificant, not nothing, or not that much of significance. So if brain doesn't perceive it as significant, so it won't have much effect or no effect. But for someone brains, it's very important, like event for him or her. So that's gonna, and again, this genetics, epigenetics, and all, so many factors are there to say that CSA leading to this. So I think these are the points in nutshell. Like, first of all, the CSA is one of the ELS, and then there is not one-to-one relationship. Like, in whatever we till our finding in that, I put this disclaimer that this is saying this neglect causing this methylation, this thing and all. We are not sure. At the same day, multiple things can happen. At the same day, the child can have sexual abuse, can have other kind of stress, and which one causing this, we don't know. So, but while taking history, every time childhood history, CSA, 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 find out this thing, the duration, who was their relationship, and all that stuff. So, with that, what clinical importance is with that, I don't understand. So, for me, CSA is like any other ELS I have discussed. Over to Sir.
And the thing is, uh, it is actually a very interesting story, a story built up to validate various theories which can never be proven. Let's say, let me first give a scenario. Let's say a patient is sitting in front of, and he or she is describing something that has happened in their childhood and that is very stressful to them. First, that person who is describing it
Oh, so recall
might,
bias, right?
yes, might or might not have anything uh, of that nature in their actually immediate memory or something like that. And they might have been just retelling their emotional feeling. This is their fault. And now, what would be my fault? I would then think that, oh, this has happened. So, this would cause methylation in this area. This would cause this HP axis dysfunction. And then I would go into describing those biological changes that I thought, and I would try to go behind treatment of this. So, it is a double bias. Then the thing is, it has already mentioned that the epigenetic mark. What is epigenetic mark? Epigenetic marks are marks that happen only when there is loose epigenetic regulation inside the body. In fact, widespread methylation, widespread acetylation, these are the things that happen when there is inadequate epigenetic control and a person is very, very vulnerable. So, if we find widespread epigenetic changes in a person, we first should check for, is there any regulation mechanism defect, or rather than we go jump into whatever abuse that person is describing. These are multiple bias. Point, if I go by point, early life stress would become a fable. For example, most of the, I have already talked about this, most of the early life stress stories come from observation of animal. Maternal deprivation in animal doesn't equate to early life stress in human. That is a kind of anthropomorphism of some other behavior. Then also, the other epigenetic, the other early life stress that has been so highlighted is orphanages. In orphanage, they have found that early life stress is there, and that is due to that social deprivation, emotional deprivation, the children are growing less. But problem is, these are extreme situations, And in this extreme situation, we don't even know what has happened, because people who are given away to orphanage for adoption, they are mostly unwanted child. When unwanted childs are coming, when the parents were impulsive, when the parents had no means to care for the child, when the parents were not fit to be parents. All these three actually signifies genetic defect inside these parents. These parents are not fit to be a normal human being most of the time. And so these babies are already born with their own genetic defect. So implying that emotional deprivation of the orphanage is causing all these things would be an oversimplification. Every early life stage story is a beautiful story based on an assumption which should never be proven, because to prove it, we have to take a healthy offspring from a healthy parent, gather a group of healthy offspring from a group of healthy human parents, then we have to expose them to all the so-called adversities one by one. And we have to check their genetic profile, epigenetic profile, neuroendocrine profile, and everything. We can never do it. And as we can never do it, we can never prove or disapprove early life. That is the beauty as well as parts of something. It is scientific. If we say something is scientific, then there must be falsifiability attached to that scientific theory. Early life space is not falsified. There is no way we can prove early life space doesn't exist. And that makes early life space something that is more of a story rather than a scientific fact. People have gone silent.
No, I think people were listening and paying attention to what you were saying. And I think that's a very good encapsulation of the entire session as well. With this, I'm going to hand over the session to Dr. Rajkumar to take it forward.
Thank you, Dr. Rishada. Thank you, Dr. Susmita, for the presentation, and Dr. Bhaskar for the discussion too. We come back with another session on the 23rd of April. Till then, it is goodbye and good night to all of you.
Bye.
Bye.
Bye bye.